Well, this is Dr. Batts, and I am excited that February is Heart Health Awareness Month. Like I said, I have a host of colleagues coming to join me just to have a cardiac conversation about risk factors and various things that impact your health. Well, today we have, again, one of our newest additions to the clinic that has been nothing but a champion for health and wellness of our patients. But he's tackling an issue that is bigger than many of us could ever imagine. The obesity epidemic is not only one that impacts our overall health, but it impacts national security. Data from the CDC in 2022 revealed that 71% of Americans would not qualify for military recruitment due to being overweight or obese. In terms of overall cost, obesity and obesity-related diseases contribute to our overall health and wellness. Well, I'm not going to waste any more time. I want to get one of our experts to talk about it. Today, I present to some and introduce to others Dr. Garza, one of our lead pharmacists in the cardiology clinic at Wilford Hall. Dr. Garza, how are you doing today?
I'm doing great. Good morning. It's a pleasure to be here.
Excellent.
Happy to talk about obesity.
Well, first, why pharmacy? What made you pick pharmacy?
Oh, well, I mean, that starts way back when I was younger, still an athlete in high school, playing sports, just wanting to do better for myself, eat right, make sure I'm doing the right workouts. And along with that came, okay, what am I putting in my body? What vitamins, what minerals? I kind of went down this rabbit hole of like medications and, all this medicine that we take on a daily basis for some people. And that's kind of what piqued my interest in pharmacy.
Wow. I mean, and I think that's a wonderful story for folks to hear, because what I tell people is when they start to get on that supplement train, I said it's just that. It's a supplement to already supposedly good nutrition.
Exactly,
right? And the
yeah.
fact that you were able to look at that and really have a passion and a purpose about how to do that is fantastic. Now, it didn't just stop there, because you carried that over. When we first met, you talked about obesity and those type things and how you wanted to battle that. So what is obesity?
Yeah, so actually the American Medical Association finally made obesity a disease state back in 2013. And so obesity, it's really easily classified something called body mass index, or BMI for short. It's basically height versus weight. You get a number. Anything above 30 is class 1 obese. So anything above 30, patient is obese.
So, if your BMI is elevated above 30, already fall into that obese category.
Yeah.
Now, obesity, I know it can happen over time. So what are some of the contributing factors that lead to obesity?
Yeah, it's really multifaceted. There's so many different things that can cause someone to go down that path. Things can be genetic, poor genetics, environmental, psychological, and even socioeconomic. People may not have the right resources around them to be able to, live a healthier, active lifestyle.
Yeah, and it's interesting that you mentioned socioeconomic, because I know, at least in the military, there's this thought that, okay, we all have access. We all have access to healthcare, access to healthy foods, but, they're starting to do, at least in primary care, what's called a food scarcity index, right? To see how much available good food do you have. Now, we hadn't seen that yet in cardiology, but it's certainly something that I think should pique a chord in all of us to understand that as much as we think we're not vulnerable to related issues and diseases, we are. Now, you talked about the genetics behind obesity and social determinants of health that impact it. So what are some of the complications of obesity? I mean, what can happen to folks?
Yeah, really, obesity can touch almost every disease state out there that you can think of, especially in cardiology, high blood pressure, heart disease, other things, diabetes, infertility issues in women, hypogonadism. There's a slew of things that we like to call weight-related complications, that because someone is overweight, they can have osteoarthritis, just different things, high cholesterol. So it can really touch almost everything.
And I like how you simplify. You said weight-related complications. It might not be a disease state, but these are things that I'm assuming people wouldn't have if they didn't have the weight.
Yeah.
I know you said, hey, look, I want to tell my patients and the patients that I care for, This doesn't have to be your end state. So how can someone prevent obesity?
Yeah.
Or can you prevent it?
Yeah, absolutely. A preventative is the best way to go, especially if you're young, healthy. Start now. Don't wait until you become overweight to start trying to work on the problem. So for prevention, it's really dietary and exercise. Make some dietary modifications. Exercise, doing moderate intensity exercise. I mean, what is moderate intensity, right? We like to throw that around a lot. As
Moderate for you might not be moderate for me.
Exactly. I mean, some things, I like to give patients ideas as far as physical activity. Playing basketball, swimming, golf, tennis, pickleball is very popular now. So that would fall under that role, moderate intensity, right? You're not pushing yourself to the limit.
Mm-hmm.
You're not
Still able to talk a little bit.
Yeah. And it's not as, relaxed as just walking.
Right, right. And walking's not a bad option. I mean, I'm not as young as you. I used to be an athlete, but I'm still an athlete.
Yeah.
I'm an athlete. But I walk. I do about 30 minutes on a treadmill. Now, I do increase the incline to 12. Rate is at about 4 miles an hour. So it's still a work. It's still work.
No,
that's not really. That's walking, but that's a different type of walk.
Yeah, you're basically on a hike at that point if you're in an incline.
So it's some work. Now, we talked about prevention, but I know sometimes even those preventive strategies, due to genetics, the environment, as we talked about food scarcity, unfortunately don't happen.
Yeah.
So what treatment options, either pharmacologic, and we won't touch on the surgical treatment options, but what are some pharmacologic treatment options for obesity?
Yeah, well, there's been a lot of changes happening in that realm as far as medication therapy. We've had medications for a long time, oral medications that patients can take by mouth, more short-term medications that don't have like as lasting of a benefit with the different side effect profiles. Now we have injectable medications. Previously were used for diabetes, did very well for diabetic patients, low events of hypoglycemia, low blood sugar for diabetic patients. And as one of the side effects that they noticed with these injectable medications for these diabetic patients is that they were losing weight. And so they had a thought maybe that it could help patients who were just overweight, who didn't have any diabetes. And so that's really what the push is for right now, especially because those medications, those injectable medications, produce the best results, the most amount of weight loss for patients. So patients, especially who can't do any preventative work, who maybe have back problems, chronic pain, issues where prevent them from exercising, and even though they're eating right and doing all the right things, they just can't incorporate that exercise. These injectables really fill in that gap before surgery.
Wow.
So,
I mean, and you're talking injecting. I know I don't want to say it, but I'm going to say the GLP-1 receptor agonists are the the Ozempics and those type things. And not that we're making it's just and not that I know this is for patients, but there was a trial, the SELECT trial, that really said, hey, look, weight loss, whether you have diabetes or not, reduces your cardiovascular risk. So we can go down a rabbit hole.
Yeah.
I was excited to see that. Now, we talked about prevention, we talked about treatment, but when we talk about patients kind of finding their way and doing it, what would be 3 things that you want to say to patients with respect to identifying obesity, treating it, and living that life to reduce that risk?
Yeah, the first thing I want to say is be a good patient advocate for yourself. Really, I mean, no matter how motivated I am to help you, really, you yourself are going to need to have that motivation within you to be able to go on this journey. Another thing I would like to point out is being consistent. It's very much important to be consistent. I know starting out is always the hardest part, but being consistent in trying to lose weight is very important. The third thing I'd say is that there's help out there. There's resources. There's multiple health professionals out there, whether it's nutritional medicine, a pharmacist like myself, a cardiologist. You have so many different people out there who want to help you. So you're not alone, and there's help out there.
Wow. I mean, like I said, you just gave us keys, nuggets, tools to build on, even as a provider. And I appreciate your service, appreciate the work that you do. Maybe you can help me be a better athlete, my friend.
Yeah.
Thank you. Have a great day, Dr.
Thank you. Thank you. Pleasure.